What do you do when your patient says they don't use any cannabis, but they reek of it?
Find out today on Medical History Mysteries.
Hey, everybody, we're continuing our coverage of dental professionals are human too. And we're talking about different scenarios that might come up that might bring us an ethical dilemma, any sort of challenges, or if sometimes we make mistakes, how do we fix it? And so this week, we're talking about cannabis use. We all know what that smells like, especially if you belong to a state that has legalized it. You can't really miss it anywhere. But what happens when you have a patient in your chair who clearly says they do not use cannabis, but they reek of it?
So, this is a problem that comes up often. A lot of my audience members, when I give my lectures on cannabis, say to me, yeah, but I've asked my patient and they specifically say no, they don't use cannabis. But it's like the minute they walk into the operatory, I'm getting a contact high. Like I can sense, I can smell it. I know it's there. They say no, but I know better. All right. So, first things first, realize that the patient may live with someone who uses cannabis. They don't use it themselves, but the partner, the roommate, whoever uses cannabis, and because they use cannabis indoors, it ends up on their clothing. So when they sit down and you get that whiff, it smells like cannabis, and they're saying they don't use it, they may actually be telling you the truth. They may have also been driving with someone who uses cannabis, or even in an automobile where someone used cannabis before they got in. This happened to me. I ordered an Uber to get from a hotel to an airport. I got in the car and I'm looking at the driver like, maybe I should get another Uber because you and the whole car smell like marijuana. No, 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 that's not me. It was the guy before you. Okay, needless to say, I'm biting off my fingernails as we're driving to the airport, looking at his cognition, looking at his driving skills. Seemed okay to me, but when I got out of the Uber at the airport, now I smell like I was using cannabis and I got to walk through TSA. So I'm getting nervous. Okay, uh-oh, this is not going to be good. So I can't tell if someone's using cannabis or not just based on their smell, based on, lots of extraneous information. All I can do is ask and say, okay, do you use cannabis? If they say, no, I do not, the most important thing you do at that moment is you document that in a chart. Patient denies the use of substances. Now, if you suspect, no, no, it's not that they live with somebody. No, they weren't in an Uber. No, they didn't drive, especially if you've seen them outside through the window using cannabis in their car and they tell you, no, I don't use cannabis. Then the next part of that is, patient denies use of cannabis, but I have strong suspicion that they may, based on, other evidence. I think that way you cover yourself because you've said no, they said no, but yes, you believe so. And then I would treat that patient. I would make their treatment plan such that it would appear that it's a treatment plan for someone who does use cannabis. Take the precaution because even if they said no and they do use cannabis, at least you're prepared. So assume that they use it, even if they don't, because you suspect that they do. That's the safest way. Now, let's say the patient doesn't use cannabis. Fine. What if they use it and they say no? You said, okay, Tom, design the treatment plan for as if they did. What does that mean? What kind of precautions should I take? What kind of things should I do? How do I treatment plan for this patient? Well, number one, consider the fact that they're going to have xerostomia. If you see they've got dry mouth, and you're suspicious they're using cannabis, they say no, you might know better. So, okay, give them treatments for their xerostomia, right? You might see that they have tachycardia, or they might have elevated blood pressure when you take their blood pressure and pulse. You are taking their blood pressure and pulse every time, right? So again, you see these obvious symptoms. Okay, I'm a little more suspicious now. You find that cannabis use causes immunosuppression. Okay, you see the obvious signs of candidiasis and fungal pharyngitis. Again, you're suspicious, but the treatment plan is according to what you believe you should do for a patient who uses cannabis. So go along those lines. Keep in mind, yes, cannabis can cause xerostomia, it can cause hypertension, it can cause tachycardia, it can cause immunosuppression, and it can make a patient more difficult to anesthetize. But be careful, because if you listened to this podcast and you left here thinking, okay, that idiot Viola told me patients who use cannabis are more difficult to anesthetize. I've got a patient, I'm pretty sure they're using cannabis. I'm going to give them more anesthesia and more epinephrine to make sure that they're profoundly anesthetized. Slow down, because now you realize you just said, I'm going to give someone who I know is using cannabis, who's hypertensive and tachycardic from using cannabis, more epinephrine. That can't be a good strategy. So once you know enough about cannabis, you can design the treatment plan accordingly. If you're going for sedation, remember, the studies on this are conflicting. You can look at the Journal of Maxillofacial Surgery and find two articles that completely contradict each other when it comes to when if a patient is a cannabis user, are they more difficult to sedate or not? Do they require more sedative or not? So again, treat them like they are a cannabis user and go with the flow as far as sedation, find out how sedation affects them. And you're documenting everything in the chart so that you don't have to make these decisions later. And if you have an associate or you're a hygienist, they don't have to make those decisions as well because you've documented the chart accordingly. But here's the question, Pam. How many of us complete all of our notes at the end of every appointment for every patient interaction? It takes time, maybe time you don't have. But this is where you've got to rise above and say, look, I got to get this down. I don't care if I write it in hieroglyphics so somebody can ask me later. I got to get this down in the chart so that I don't have to worry about this later. If you think, with all due respect, that at the end of the day, you're going to go back and write all those notes for those patients on your free time, trust me, love you, but you're probably going to forget something.
Most definitely. Oh my gosh, so many things to talk about. I feel like I would ask the question. I think I would take it the step further. If the patient denies the use of cannabis, but they smell like it, I think I would say, I think so. No judgment. I don't care, but I can smell it on you, and I have no problem. I don't care what you do, but it's important that I can treat you safely. So can you explain, I don't know how I would word it. I'd have to give it some thought to say it a nice way and a not judgmental way. But I think I would ask. I think I would probe into why they smell like that.
Agreed. Yeah, I think it's about back to that point we made in a previous episode about the confidence and the relationship. Having that confidence in you as my provider, my clinician, I might tell you I'm where I don't tell anybody else. That's fine. But if I'm resistant to tell you, that speaks volumes to me about my confidence in you and my ability to open up to you and tell you things because maybe I don't have that sense of trust that I should. And that's something we can foster with our patients and let them realize, we're not the DEA, we're not the police. We just need to know. That's all.
Absolutely. And another thing we have to consider is that our patients need to be of sound mind to properly and legally provide informed consent for the procedures that we
Well,
perform.
well, I didn't want to bring it up, but since you mentioned it, if a patient does say, yes, I actually use cannabis, and yes, the reason I reek is because I was out in the parking lot using cannabis 15 minutes ago, to take the edge off, would you treat them? Can they sign an informed consent? Can they sign a fiduciary obligation document? What's intoxicated? See, with alcohol, let's say a patient said, yeah, I was out in the parking lot and did a fifth of vodka. Okay, well, probably not going to treat you today. Why? Because I know with alcohol, I have a scale, right? So much alcohol consumption, so much blood level of alcohol, so much, inebriation means so much incapacitation, right? So you're incapacitated. You can't make that decision. You can't sign any documents, fine. But I have that scale with alcohol. I don't have that scale with cannabis. So I don't know how much cannabis consumption equals how much incapacitation. And especially if they deny it, what do? Make them sign anyway? So my advice in that situation, again, is treat them like they are using cannabis, even if they deny it, and say, look, you know what? Let's postpone. let's have you sign that document another day, you know, and be honest and say, this is the reason why I don't think you need to sign this document today. You're telling me you don't, you smell like you are. I don't know what to say here. I don't want them to sign an informed consent. You do the work. They sign a fiduciary responsible document. You charge them for the service that you provided, and then later on they say, "Hey, I was under the influence, so I can't be held responsible for any of that." And I never really approved that treatment. You did it anyway. I mean, in that situation, the patient could, in some states, file a suit against you for malpractice, saying you performed a procedure on them that they didn't approve of. I take that chance. If it's really important to them and really important to you, tell them to come back when they don't smell like cannabis, and they'll take steps to make sure they don't. And that's how you'll know what to do from there.
And it's great to get ahead of it. Have a question on your medical history. So maybe before you are trying to perform and actually carry out the treatment plan that you created, hopefully you can have this conversation upfront so that you can treat them safely, but also make sure that they can legally agree to your recommended care. So, whoa, great advice, big topic. And also for us, we should probably maybe meet as dental practitioners in a dental office as to how are we going to ask the questions. You know, you might ask it differently than I might ask it, and it could be interpreted a totally different way. So let's see what you do as a team and how you as a team would approach this topic. So food for
And
thought.
come up with a policy and consult a local attorney, an attorney who works or is near your municipality, because the laws can change by municipality. Come up with a procedure, a policy for your office that says, if you've used cannabis within so many hours, 24 hours, whatever it is, we will refuse treatment. And make that policy the law of the land in your office, not just for patients, but for employees too, and make sure there's no exceptions. Because once you have a policy, if you don't apply it evenly to everybody, someone could always come back at you and say you discriminated against me and so on. So have a policy in place. That'll be your best defense.
I love that. So Taylor Swift, they call them Easter eggs when you drop a little hint on what's to come. So join us next week where we talk about cannabis use from your coworkers and colleagues. So we'll see you then.
See you then, everybody.